You're listening to Navigating Eldercare, where you'll find guidance and answers for every step of the eldercare journey. Each week, eldercare advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Eldercare. For years, I have been helping families, medical providers, doctors, case managers, social workers, nurses find the right care solutions for seniors in transition, whether that is after a hospital stay, a rehabilitation stay, or when care needs at home have changed. We assist in finding the right care options for those needing care. I started this work because I saw how overwhelming and confusing the elder process can be, and I wanted to be a guide and a resource for families and professionals. Each week on Navigating Eldercare, we tackle real questions and challenges that families and providers face during care transitions. I have spent over 32 years working as a registered nurse, specializing in geriatric care and transitional care planning. This podcast brings together my experience and my passion that can support you on your care journey. In my business and in my work at Care Advocates, we walk alongside families every step of the way. We meet with families, clients, providers to create a customized care plan. When someone is needing care, assistance with activities of daily living such as bathing, transfers, mobility, we really learn and get to know our clients. We get to know what the care needs are, their budget, their limitations, their abilities. We get to understand their unique situation, what location they would like to move to. We provide them with options such as residential care homes, assisted living communities, memory care communities, or if they wish to remain at home, we bring in community resources into the home. We advocate, guide, and educate throughout the entire process, but most importantly, we provide ongoing solutions and support. The care journey should never feel overwhelming. It should feel guided, supported, and understood. Welcome back to Navigating Eldercare. I am your host, Laura Daniels, and in today's episode, we are going to talk about a very important question. How do you know when your parent may need assistance or assisted living? So that's a little bit about what we're going to talk about today. In this episode, we will walk you through the common signs that can signal if somebody may be needing assisted living or care in the home. We will talk about how to recognize when everyday forgetfulness becomes something more serious. And we will also highlight what to watch for if memory care may be needed, such as disorientation, repeating questions, or difficulty with language. Our goal is to help you feel confident in recognizing when it is time to take the next step so that you can support your loved one with safety, dignity, and compassion. When it comes to aging, the need for assistance can be significant. Statistics tell us that over 70% of those turning 65 are going to need some type of assistance at home. That means assistance with mobility, transfers, meal preparation, medication administration, bathing, dressing, toileting. Additionally, data tells us that half of adults will develop a serious diagnosis or disability after the age of 65 that will require long-term assistance, paid services, and support. So what are the signs that your loved one may be ready for assisted living? It can be hard to see the big picture when the changes show up in small scattered moments. But once you start connecting the dots, memory lapses, the shifts in mobility, the falls, household neglect, or growing isolation, they often point to the need for a higher level of support to provide safety. Recognizing when a loved one may need assisted living is never easy. The decision is often driven by a mix of physical, cognitive, and emotional changes that affect both safety and quality of life. While many seniors want to remain at home, living without 24-hour assistance when it's needed can pose serious risk. Assisted living can offer a safe, supportive environment where your loved one maintains independence while receiving the right level of care. And it's not just about assisted living. Your loved one and yourself can age at home with the right support. So what are the signs to look for? Sometimes the signs are obvious, like a major fall or a physician's recommendation or a case manager at a hospital telling yourself or the daughter or of your loved one that it is time to consider assistance or assisted living. Other times these signs are subtle, like just forgetting to lock the door or missing a few doses of medication. Today we're going to talk about some of the most common signs that it may be time to consider assisted living or care in the home. So we're going to talk about the first one. Number one, a decline in health. So some of those signs can be frequent falls, injuries, multiple hospital visits that can indicate that living alone is unsafe. Loss of mobility, chronic conditions such as heart disease, arthritis, diabetes, all of this can make it difficult to manage daily tasks like dressing, bathing, meal preparation. When we talk about decline in health, we're also talking about missed medication or neglected medical problems are also red flags when appointments are being missed. So all of these are signs that fall under decline in health. The second sign is difficulties with activities of daily living. So what are activities of daily living? When we use this term, ADLs, we're talking about grooming, bathing, dressing, toileting. So struggling with activities such as all of that, grooming, bathing, cooking, cleaning, mobility, or just laundry, all of that can suggest that extra support is needed. Poor hygiene, weight loss from skipped meals, or difficulty managing medications are often early indications that assistance is needed in the home. The third sign can be cognitive changes, memory loss, confusion, disorientation that starts interfering with daily functioning, difficulty managing finances, forgetting to pay bills, forgetting to take medications, or just getting lost in familiar places, walking into the wrong door. All of that can point to the need for a safer, structured environment. And as we get older, everyone's forgetful, but when this starts becoming a pattern and it starts becoming unsafe, those are signs that perhaps assistance in the home is needed or assistance outside the home is needed. Number 4, social withdrawal, loneliness, isolation, emotional changes. Isolation is very common as people age, especially if they lose a spouse. But you start seeing things, they stop driving, they lose connections with friends, families, they become very isolated. A lack of social interaction can lead to depression, can lead to anxiety. And when you start seeing a lot of withdrawal like this, that is concerning. You want your loved one to be connected, have a sense of community, have people around them, whether that's just bringing support into the home or finding those social connections outside of the home in an independent living community or an assisted living community. Number 5, another sign that your loved one may need assistance with care is unsafe living conditions. So when you walk into your mom's home, your dad's home, or you think of yourself as an older person living at home, an unkept home, expired food, unsafe hazards like cluttered hallways, poor lighting, all of that may signal that maintaining the household is becoming too much work and extremely challenging. These conditions increase the risk of accidents, falls, and poor nutrition. Number 6, poor hygiene or weight loss. Another important sign for you to look at in your loved one. Noticeable changes in appearance, such as wearing the same clothes for the second, third day in a row, soiled clothes, body odor, significant weight loss. All of that can result from difficulty in bathing, doing laundry, keeping up with laundry, meal preparation. You see signs of depression. All of these are signs that your loved one or yourself may need care at home or assistance outside of the home. One thing to know is that in any type of care facility, assisted living, memory care, residential care home, all of this ensures that you or your loved one are provided with all of the care that you need, from nutritious meals, snacks, attention, medication administration, laundry services, and personal care with all the assistance that you may need. Number 7, another big sign, caregiver stress. Family Family caregivers often face burnout, juggling their own responsibilities while trying to provide around-the-clock care for their parent. If you are a caregiver of your mom or dad and you're noticing that you have to be there every day or a few times a day, it can become very taxing. If the emotional, physical, and financial strain is overwhelming, there are other options such as assisted living that can offer much-needed relief and peace of mind. And also understand that it's not forever, right? So when we talk about needing assistance, maybe just a respite stay to try out assisted living so you can see what that's like. But caregiver stress is a big, big issue, and that's a topic that we are going to dedicate a whole episode on. Caregiver stress and caregiver burnout. Number 8, care coordination challenges. When you start seeing multiple medical appointments, missed medical appointments, hospitalizations, rehab stays, or a lot of specialist visits, all of that can be overwhelming for families, especially the caregiver who's having to coordinate all this. Or you yourself as an older adult that's home alone, it can be very difficult to go to these appointments, and these missed appointments can cause a decline in health, leading to hospitalizations and rehab stays, etc. Know that when you are in care at assisted living, a lot of medical resources come into the home. Medical on-site professionals, transportations to appointments, regular communication with physicians can streamline a lot of the care. So that's another big sign, care coordination, and the challenges that you face as your loved one starts needing more care and more visits and more appointments. Number 9, a doctor recommends assisted living, or a doctor's recommending that it is unsafe for you or for your loved one, mom and dad, for them to be home. So when you get that recommendation once, twice from a professional, a doctor or a social worker, that really signals to making a safer choice, finding an option that is going to provide safety for yourself or for your loved one. So a doctor's input can really validate a family's concern and help that older adult feel more confident in the transition that they're going to make. And sometimes a loved one mentioning it is not enough. They sometimes have to hear it after a hospital stay from a doctor, from a therapy director or social worker. That seems to resonate more than a loved one or a daughter mentioning it. Number 10, when the needs exceed what a family can provide. So if a family member that is providing care and assistance for their mom or dad or for a loved one is starting to miss work, lose sleep, or the relationships are strained, it's time to really think about transitioning care, really having assistance, having somebody come into the home and provide care with a caregiver, or start thinking about assisted living options. Assisted living allows families to focus on being loved, and once again, instead of being that full-time caregiver. And those are the 10 most common signs that it may be time to consider some type of assisted living or assistance at home for yourself or for your loved one. And the next topic we're going to talk about is memory care specifically. And when it comes to memory care, here's some additional signs, red flags, that you can watch for. Key signs that your loved one, your parent, may be needing memory care. Frequent disorientation. You may notice your loved one becoming confused about time, place, or even forgetting familiar faces. This goes beyond the ordinary forgetfulness and can be very unsettling for both you and them. It can really be alarming when they are forgetting where they're at or forgetting where they're going. Another sign is wandering or getting lost. That is another red flag. If they leave home unexpectedly, or they can't find their way back home, or they can't remember where they're going, a place that they've known for years, this is something to take into consideration. Wandering can be one of the biggest safety concerns for families, especially if somebody's walking out the door or getting lost. This is a sign that you need to look for. Another sign is repeating questions or stories. And of course, we've talked about how as we get older, it's normal for all of us to forget things now and then. But if your loved one is asking the same question multiple times within minutes, it could be a sign that memory care may be needed. Difficulty with daily tasks despite reminders. This is another sign to look for. Maybe you've noticed that your loved one can't remember how to cook their favorite meal. They can't remember simple tasks as dialing a phone number or using a microwave or following through with simple routines. Even with notes or reminders, that's often when extra support becomes essential. Another sign is personality or behavior changes. If your loved one seems more agitated, suspicious, more withdrawn than usual, or when their mood swings change quickly, those emotional changes can point towards dementia-related decline, and memory care is designed to support that. But most importantly, consulting a doctor, again, a geriatric medical doctor that focuses on older adults, to really get a good assessment and a diagnosis as to what's going on. Another sign that your parent may need memory care is a decline in judgment and decision making. For example, giving away money, falling for scams, or unsafe choices like driving when they should not be driving. These are signs that they may no longer be managing well on their own. Another sign is loss of interest in what they once loved, activities. When hobbies, conversations, or family visits are no longer bringing them joy or engagement, it may mean that cognitive decline is interfering with their ability to connect with you or with those things that they love or loved. And another sign that your loved one may need memory care is safety risks at home. Forgetting to lock doors, wandering at night, getting up in the middle of the night, forgetting where the bathroom is, leaving the stove on. Those are all major concerns that memory care community may be an option, and those are uniquely equipped to handle someone safely in a structured environment. So what do you do next when you recognize these signs in your loved ones? Not just memory care signs, but all of the first 10 signs that we talked about: the decline in health, the difficulty with daily activities of daily living, cognitive changes, social withdrawal, loneliness, emotional changes, the unsafe living conditions. We talked about poor hygiene and weight loss, caregiver stress, care coordination challenges. When a doctor recommends assistance for your loved one, and when the care needs exceed what a family can provide, what are the next steps? If you recognize one or more of these signs, including the memory care signs that we talked about, start by consulting with your loved one. Again, a gerontologist, a geriatric doctor that focuses on older adults. One thing to remember is that older adults do present symptoms very differently than someone that's 30, 40, 50, even 60. Urinary tract infections present differently. Cognitive changes also present very differently. It's important to see a specialist that focuses on senior care and older adults. Another next step is just bringing support into the home. That can be a start. It can provide safety until you get a better assessment of what the care needs are and how much care yourself or your loved one needs. And just starting that conversation. Start the conversation. People often wait until a crisis occurs before discussing what their preferences are, what they want, their values, what their healthcare wishes are, all of the financial details that we don't want to discuss. Waiting until you or your loved one has a serious accident, fall, or a major diagnosis to make a big decision like this can lead to a lot of assumptions, a lot of anxiety, a lot of stress. And you can avoid all of this by just talking to your loved one before anything happens. These conversations can be so hard, so it's easy for us to avoid them and delay them. We never feel like it's the right moment for us to discuss a topic we believe will be uncomfortable. But it may surprise you to learn that maybe your mom and dad are ready to have this conversation and they just don't know where to start. So find that opportunity and begin this important conversation. And I'll give you 4 ideas on how you can start the conversation with your loved one, with your mom and dad. Maybe you can mention, Mom, you mentioned that your knees were bothering you. Does this cause problems when you're walking up and down the stairs or when you're driving? It opens the door for them to tell you, you know what it does. I've been having a lot of issues with my knees. I'm afraid to fall. So that's one way of starting that conversation. Another one is, Mom, I just read an interesting article on how to gather all of your important documents. You can show me yours and tell us what to do in the event of an emergency, Mom, or if you fall and you're in the hospital, where are your documents at? Do you have your power of attorney ready? What kind of rehab would you like? What do you want your care to look like? So that's another great way to start a conversation before something big happens. Another example is, you can tell your mom, if you want to consider staying in this house for a while, and I know you and Dad love this house, let's talk about the stairs, because the stairs can be a problem as you get older and you're not able to walk up and down like you are now. Let's talk about the stairs and let's have a plan B as to what to do with that. And the last example I can give you is just another great conversation starter, saying, Dad, you were complaining about your vision. Do you have any problems with your eyesight when you're reading, when you're driving? And that really opens the door to many other things. Once you start that very light conversation, you bring up reading and driving as a possible future problem, then you can get better insight as to what the needs are, what the care needs are. So having that open conversation, talk to your loved ones about their care preferences and the benefits of care in the home or future assisted living outside of the home. One thing to note also is to remember that assisted living means more safety, dignity, and quality of life. It's important to explore assisted living options that fit your family's care needs, budget, location. Assisted living communities offer many amenities, many care options. Transitioning to assisted care may feel like a loss of independence for your loved one or for yourself, but in reality, it often provides greater safety, dignity, and quality of life for both older adults and their families. The truth is that, and I've mentioned this before, 90% of those families that we assist with finding care options happen in a moment of crisis, when Dad has fallen and broken a hip, or when Mom had a severe stroke, or Dad has wandered outside and was lost for 30 minutes. In those moments, decisions are rushed and choices are limited. So it's important to really start planning ahead to what you want your care to look like when you do need care, if you ever need care. Planning ahead matters so much. By starting the conversation early and knowing your options, you give your loved one and your family the gift of time, choice, and peace of mind. Instead of reacting in panic, you can make an educated, thoughtful decision that truly supports your parents' well-being or your wishes. Remember, the best time to plan is before you need it. And in talking about planning, in our next episode, we will discuss how to create a caregiving plan for yourself or for your loved one. And I actually have an ebook that I wrote on that, and we'll give you the link next episode. But creating a caregiving plan for your loved one. Caring for your loved one or a family member is one of the most important roles that you will ever have. You may begin by driving your loved one to the grocery store or to the doctor. You may later find yourself spending more time at home with them, cooking their meals, paying their bills. You and your loved ones will find it is easier to navigate the caregiving journey if you have a framework to guide you. This guide that we will discuss next week can help you provide care for yourself or for your loved one. This guide will provide you with information, checklists, and resources to help you become organized and help you find support. So what is a caregiving plan? A care plan outlines your loved one's care needs. It promotes better health, safety, and quality of life. Care plans are different from a plan of care, which your loved one's doctor will typically provide. A caregiving plan helps you prepare for non-medical needs, arrange outside care support, prepare you for future care transitions and personal needs. This can lead to better communication, safety, and less stress. At some point, most older adults will need help getting through each day. This means requiring assistance with basic living activities such as personal care, bathing, dressing, walking, mobility. Medicare typically doesn't pay for long-term care. Typically, this is called custodial care. Most families do not begin planning for this type of care until they're faced with a health crisis. This can lead to unnecessary stress, disagreements, and rising expenses that can happen from not preparing for future care needs. Having a care plan well in advance allows families to get organized, locate appropriate resources, and prepare before a crisis hits. A care plan is a thinking through every step of what you or your loved one is going to need as you age to ensure safety and preparedness. And on our next episode, we will discuss 8 topics to explore before creating a caregiving plan. Thank you for joining me on Navigating Eldercare, where we bring guidance and answers for every step of the elder care journey. If you are a family member, hospital case manager, or a healthcare provider, and you know someone facing a change in health or planning for future care needs, Care Advocates is here to help you find the right care at the right time. Whether it is assisted living, memory care, or bringing trusted resources, community resources into your home, we walk alongside you every step of the way. At Care Advocates, we meet with you personally. We create a customized care plan. We discuss care options that fit your care needs. We provide ongoing solutions and support. Our commitment is simple: care, compassion, lifetime support. For a free consultation, call me at 210-669-2222. Be sure to like and share this podcast and visit us at advocatern.com for helpful resources. If you have a question or an idea for a future episode, email me at Laura, Laura, at advocatern.com. That is ADVOCATERN.com. You can also listen to us every Sunday morning at 8:30 here on 9:30 a.m. The Answer, or listen to us on your favorite podcast app. I am Laura Daniels, and this has been Navigating Elder Care, helping you find the right care at the right time for the people that matter the most.
This has been Navigating Eldercare with Laura Daniels, providing guidance and answers for every step of the elder care journey. For a free consultation, call 210-669-2222 or email Laura at advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com.